everybody, welcome to the Total Wellness Center Occupational Therapy channel. Today we're going to talk about some of the different strategies we can use for lateral epicondylitis, so stick around for the video. Part of the treatment for lateral epicondylitis at the elbow can be counterforce brace, wrist cock-up brace, moist heat, massage, and ice packs. So today we're going to talk about some of those strategies that you can use to help this condition. One of the tools we use for lateral epicondylitis is the Counterforce Brace. This is a brace that wraps around your forearm circumferentially. It has a pad that we place on the muscles that on the One of the tools we use for lateral epicondylitis is the Counterforce Brace. This is a brace that wraps around your forearm circumferentially. It has a pad that we place proximal to the lateral epicondyle over the bodies of the muscles that originate at the epicondyle. This brace creates a new point or resistance for your wrist extensors. Think of a guitar string. When we hold down the string with our finger, we create a new note by changing the length of the string and taking tension off the rest of the string. This brace works in the same way to help you relieve tension on the lateral epicondyle. You should wear it all the time when you are awake, but take it off overnight. To put the brace on, we usually have it wrapped up to begin with, or ready to go. You're going to slide it up to your arm. You want to go to your lateral epicondyle and go 2 fingers proximal. And the brace should be 2 fingers proximal. And then we just tighten up the brace and let it sit there, put pressure over those wrist extensor muscles. A wrist cock-up brace is a tool we can use to help reduce the pain with lateral epicondylitis. By holding the wrist in a neutral position, you limit the contraction of your wrist extensor muscles and minimize pain. It can be worn both day and night, and in very acute cases, we'll usually begin to wean this as we progress with treatment. So to put the brace on, you slide it over your hand. We usually keep it bent up a little bit to reduce the tension on the brace, and you pull the straps across your forearm. Okay? Now with this brace, we want to be very careful. Usually we take it off 3 times a day, maybe for about an hour or so, kind of check the skin, relax. You want to make sure you're not getting any irritation here, or any irritation at the points that it comes into contact with your skin. You don't want it very tight. It's really just to keep the wrist from moving a lot. It doesn't have to be very tight. A lot of times what can happen is if it is too tight, it can cause other problems. So we want it just very loose. If this starts to bother you, if it's increasing your pain, if it's causing redness or areas, you can just discontinue this brace. Moist heat is probably one of the treatments that no one complains about. It provides comfort to the area, but also helps us in therapy to begin to work with the subcutaneous tissue. Heat will help to increase the extensibility of the muscles, tendons, ligaments, and other connective tissue around the lateral epicondyle. It is a good modality to employ before you complete massage or the stretching programs. It generally can help you to feel better irregardless. For most home heat applications, people will have a plug-in heater that they might use, or heat blanket or something like that. If you want to, you can take a towel, you can soak it in water, you can heat that up in the microwave for like 2 minutes, put it in a plastic bag and wrap that in another towel and place it around your elbow. Usually we kind of place it over the elbow like this, usually for about 8 minutes to try to warm up the tissue, get it to relax, things like that. Okay? Then you can complete the stretches and possibly the massage. So that's just, heat is just another way to kind of help to start to initiate the process of feeling better and getting those muscles stretched out again. Massage can also be a tool that we use in therapy to help promote healing, bring fluid to the area, relax the muscles, and even alter the alignment of the scar tissue in certain cases. The technique for massage at the lateral epicondyle is described next. To begin massage, we place our arm on a supportive surface. You want to go right distally to the lateral epicondyle, maybe just 1 or 2 fingers. You can massage making circles, you can massage going counterclockwise, clockwise, you can go the length of the muscle, or you can go across the muscle, whichever is the most comfortable. Usually we complete this 3-4 times a day for about 5 minutes each. We can follow this up possibly with the stretches that will help to remodel the tissue and kind of lengthen it a little bit, and then possibly, if you're having any pain, an ice pack afterwards. In medicine, the itis suffix that we use means inflammation. So if you see it at the end of any word, it's referring to this common reaction to an injury. Think of things like bronchitis, tendinitis. When we have inflammation, one of the strategies that we use to help that is ice. While ice doesn't help us to lengthen tissue, it can help reduce swelling, it can decrease pain, and definitely help manage the inflammatory process. I commonly use the phrase heat before, ice after with my patients, meaning that we can heat to try to mobilize the tissue and lengthen it, but at the end of the day or after a lot of activity, ice becomes the tool we use to help with the inflammatory process. Usually what I tell patients is you can use a bag of frozen peas. If you have a ice pack at home that you've purchased online or something like that, that works. You can also use a regular Ziploc bag with ice. One of the more advanced things that you can do is you can take a Ziploc bag and you mix half a cup of rubbing alcohol and half a cup of water and get the air out of the bag. Seal that in another bag and that will work in the freezer. Just be careful with that because it does get below freezing. So usually with my ice packs I'll take like a pillowcase or a towel and put it over the arm or the elbow. Usually like to do this for about 8 minutes. Usually after about 5 minutes you want to check the skin to make sure you're not getting any frostbite or anything like that. But ice can definitely be a tool that we can use a couple times a day or maybe once at the end of the day to help kind of reduce the inflammation.